So we are about to go live, just waiting for the... Yep, I think we are live right now. Good afternoon. Today is October 9th, Friday. This is our weekly educational session, and today I have Dr. Jennifer Liquido from United Medical Clinic. She's one of our pediatricians. She'll be joining us. She's here with me. I will be doing our regular updates first, and then I have Dr. It's all right. Okay, so right now my PowerPoint should be up, and we'll be starting. So normally I do give our updates from the COVID-19 numbers in the total. But before we go to that, from United Medical, if there are people who are just watching this first time, we are United Medical ACO. We provide business office services for medical practices, and we do have some. We own some of them as well. Most of you by now know what these events do because it's our 11th one, and then we have done so many others in between. So one of the things that we always want to mention is you'll hear this all the time from different health organizations with the triple aim, but our goal is to have it at a different level with the quadruple aim, which means we add our physician and physician practices into this mix, our providers. So because if the goal is to improve health, lower the cost and better patient experience, those triple aim goals cannot happen without the physician practices and physicians and providers. So that's something that we do want to mention for everyone. Hopefully everyone is following us and understanding what we are saying. Now, today I have Dr. Jennifer Liquido. I'm going to ask her to introduce herself, and then we'll start our session.
Hello, Kemal. Thank you for the opportunity. I am Jennifer Liquido. I'm one of the pediatricians under United Medical Clinics, and I thank you for the opportunity to discuss some pediatric topics today.
So, Dr. Liquido, you've been in the Smyrna location, but prior to United Medical, you were under Smyrna Medical. So, for how long have you been in Smyrna?
You're aging me on that thing. I have been in the Smyrna area since 2003, practicing with Dr. Carrie Rusal, and we've just been the pediatricians around this area for a while now. So 2003 up to 2 years ago, we were managing our own practice until last year when we joined your group.
All right. So it's been almost 17 years.
I didn't mention that.
Well, you're familiar with these. Outside of these events, we also have our provider meetings with the network. So we have done so many of these events together. Now, I do start with our numbers from United States. Right now, we are approaching to 8 million total confirmed cases with 7,842,000 with almost 218,000 deaths. And the recovered number is a little over 5 million. I put these timelines and the numbers together so that they can actually kind of make the comparison from the early on. With April 15th, we were at 1 million. So right now we're about 8 times more than that number. So this is, it's a great deal that we are going through right now. This is a big pandemic, and we want to make sure that we are providing these types of events to help our patient population. From the, I do want to actually bring the live data for, let me see if I have, from the state of Delaware. Let's see, it's right here. Okay, so the numbers that we have, first we have the current hospitalization. That total is about 101. I do, again, our goal is not to try to scare anyone, of course. We are just providing the numbers, but also we are providing some background on these issues. So this number 101 as of 2 days ago. It's a live data, so I'm actually directly doing this from the state website. Now, if you look at 2 weeks ago, that was at 60. That means more people are being they're in the hospital and they're staying in the hospital. Now, the reason I'm saying more people is if you look at the total number of new hospital admissions, COVID-related, that number actually, like the last 3 days is high, but prior to that, that number actually was pretty good control, but this is increasing. So that tells us that people are staying in the hospital for longer term when they are admitted for COVID-related issues. Now, this is our percentage of people who tested positive, and the blue bar is the 14-day average, so it's actually slightly better than the last couple of days, so it's down to 6.8. That number used to be about 8% for a while, so like first time in the last 2 days it's going down, which is good. Now, this is the new positive cases, and then here, as of 2 days ago, state updates this usually around like 2 p.m. So we didn't have the, I mean, I'm on the website again, but like probably in an hour or so, they will be updating this. So the 14-day running number is about 130 cases. Again, when you go to September 26th, that was 101. So we know that 14-day average is a strong, solid, reliable average. So we do want to actually pay attention to these. Now, of course, none of these I was trying to, I wasn't doing it because I was trying to scare you. I was just sharing these so then you can actually have the background which you are hearing this from all the other places. Now, I'm going to go back to Dr. Likido, and again, you are actually in the middle of your office hours, and thank you for doing this with us. From the pediatric side of it, I think we were kind of perhaps, I'm not going to say we didn't maybe pay attention in the beginning, but we closed the schools, and then it was closer to the semester, and then it didn't feel like we need to do much with the pediatric population. Now, school reopening, it's already there, and then there are a lot of mixed feelings. What needs to happen, what's the right decision, and we want to have the expert. You see so many patients, so many pediatric patients every day. First, actually, if you don't mind, I do want to ask you if you can explain us mortality and morbidity as terms in the medical terms, so then we can actually start the discussion.
Okay. So morbidity is simply the illness. Okay. So when you say morbidity, it's an illness. So morbidity rate is the rate of illness. So used in conjunction with COVID, you hear this a lot. So having COVID itself is a morbidity. So when they say morbidity rate, this is the rate of illness from COVID. Now, they also say comorbid factors. So these are diseases that one can have that can increase their chance of having a more severe illness from COVID. And one of the big factors is obesity. So that obesity in itself is an illness, so it's a morbidity, and it's a comorbid factor for another morbidity, which is COVID. Mortality is simply death resulting from anything. So mortality rate is the rate of death in terms of COVID. Mortality rate of COVID is the death rate from COVID illness.
So now, Dr. Likido, the issue with the pediatric population, as I was explaining, is pretty complex now because we are paying more and more attention after the school reopening. So if you can kind of give us the background from your practice day to day, what you see, what you are advising the patients, and how you guys are managing this from your side.
Okay. Well, a very important thing after the initial lockdown is to try and get the people back into the offices for their well exam and vaccinations. And you would see that was a big topic a while back because the vaccination rates went down because people are afraid to go to the facilities, to the offices, to the doctor's offices. So in our case, we made sure that we started slow, getting patients in until the staff are comfortable about what we're doing, about sanitizing, making sure nobody's in the waiting area, no mixture of patients in the waiting area. And then we're fortunate enough that we have easy access to the outside, that we were able to see and test, even swab some of the patients who were suspected with COVID outside of the office in their cars to minimize uh, uh, mixing and to minimize exposure of the staff and other patients to that. And I guess we have been pretty successful. So right now, we've had our schedules full of physicals before school started. We were able to continue vaccinating infants and school age kids. Up to now, we're still doing some sports participation physicals, which is very important since some of the sports are beginning to start right now. So I guess the people have been, our patient population have been comfortable about that maneuver that we did, and they're comfortable enough when they see us here uh, that we are taking every precaution to protect them. Now, one other thing is the use of telehealth, which is a very, very important that we have started thanks to, of course, your initiative. So we are able to at least, see a lot of patients who have simpler health problems, or at least screen them with telehealth to see if we need to bring them to the office or we need to send them somewhere else, or if it's something that we can just address and do the physical exam through telehealth, and we could address the problem and then just follow up with them. Um, and one other thing that I wanted to point out, again, with the help of the staff of United Medical, is we were able to do like a flu drive-through. So we're able to, I think, like more than 600 patients.
It's about 700 in the three different sessions.
Yeah, we're able to, in three flu drive-through days, who were able to receive their flu shots without, with minimal interaction with staff, not going into the offices. They were in their cars, they feel safe. So these were very good measures that, we were able to do as a group.
So
Um,
one of the one of the challenging part is the kids, the pediatric population is not totally independent from the adult population, so they can go through this without maybe severe situations, in a way that they can actually go through this without us losing any kids. I think the mortality rate is extremely low so far. Now, but they can be asymptomatic and then they can be carriers. So then when they come home or when they're in the school setting with the teachers, the teacher may not be, it's not going to be a pediatric population, so it's going to be an adult. So what's that, how do we balance that if we are actually sending them to school, but then they're not by themselves there, and there's the risk of them being the carrier for adult population? What would be, from your side, in your opinion, what would be the best way to manage that?
It is very, very region specific and very, based on individual as well. So CDC had come out with a table with indicators for risk of introduction and transmission of COVID-19. So it's up there, a graph of CDC website, and it is very dependent on community transmission. So if you have low community transmission, it will follow that there will also be low school transmission. And then the other big factor is for the ability of the schools to implement mitigation strategies, in enforcing consistent and correct use of mask, being able to be socially distant with each other and from the teacher, using hand hygiene, respiratory etiquette, of course, cleaning and disinfection of common areas. And if there are positive cases, of course, contact tracing in collaboration with the local health departments. Now, this also outlines a big disparity in, unfortunately, in, in school fundings, in quality of school facilities, in access of schools to educational staffing, educational resources. So, unfortunately, this brings out, some disparity in like a poor region versus a better funded region, and between public and private schools. Recognizing that, and of course, like the possibility, of course, of like they call it like a technological homework gap, with people not having enough access to computers and reliable internet connection. So these are the things that make it harder for people to do the safest thing, which is a virtual. That means no contact with anybody, virtual learning. Um, and then aside from these factors, there are a lot of stuff that school does and which are highlighted by not having them during the pandemic. And you have it on your screen. Oh, not that one. Sorry, I thought that was the one. But aside from education, school promotes social interaction, safety sometimes for some kids, monitoring them for nutritional needs, and of course physical activity. So there's a lot of good things that school does, and you have to balance this with the risk of sending them back to school. Again, as you've pointed out, there are very low cases in kids, and I think like less than 10 years old, they said that they can transmit less. So that's the what the data now is showing. But 10 and up, they said they can transmit as adults. So
So now, would it be better? So, and I don't want to put you on the spot, but I think I'm gonna do it anyway. So, would it be better to, if you and I, we don't have kids, if we had, would we send a kid to school and then just let them get it and then just be done with it, or would you actually be more protective if it was your kid?
Again, as I was saying earlier, it's a very individual decision, and being here in the community, I hear like both sides of the story. Okay, extreme sides. So those who are wanting to come in, those who are afraid to come in. Uh, I just wanted to point out, and this is something that we need to be aware of as well, that there are data about reinfection. So there is right now we're trying to get away from getting the COVID and be done with it and be safe from it, because right now there have been some cases of like proven cases of reinfection with different strains of the virus, and you can get reinfected within like 3 months of getting the first infection.
So,
So
with this question, Dr. Liquido, I actually asked, since we don't have kids, so we have two, our leadership from United Medical, they have kids. And I was, yesterday when we were prepping for this, I'm like what would be kind of like a good point to make? So then I just asked them if they would participate, and then they were nice enough to say yes. So we have John Donnelly. He's one of our directors, and we have Muriel Campos. She's our senior client manager at United Medical. So I'm going to ask them to introduce themselves, and I'm going to actually ask them the same question. And since they do have kids, just to kind of see what's happening from their side and how they are dealing with this.
John, I'll let John go first.
Thanks, Muriel. Yes, I'm John Donnelly. I'm the Director of Business Development here at United Medical. And yes, my wife and I have a 2.5-year-old son. So he was home for, I believe, about 3 months when his daycare was closed, and then his daycare reopened in the early summer when Delaware started the phase 1 reopening. So, my wife and I, of course, had conversations about whether to send him back to daycare, but ultimately we believe that the daycare was providing enough safety measures. And, again, having him in daycare, we believed far was outweighed the possibility of him contracting it or bringing it home and infecting us.
So, Muriel, your son is older than John's son. So, and you are actually doing this online learning with your kid. So, what's happening from your side?
So from my personal experience, it has been difficult doing the virtual learning for him, just because he does require specialized support. So it has been difficult. It has been definitely challenging and a transition, but I mean, we're doing it. We're doing the best we can, given the circumstances.
So the question, actually, I was just getting a warning if if there was an issue on the video, but I do have someone in the room with me. So now Muriel, I think you are a little bit. Your situation is a little bit more difficult because it's also affecting. Like you have to make adjustments with your job, with your schedule. Now, what I was thinking when they are going back to school. So how are you going to deal with that? Like, are you okay to send him back to school?
Honestly, I was not at first, and I was glad that they shut down the schools. But right now, I am glad that they are reopening the schools. I do have a confidence that the schools are doing the best that they can with sanitation and keeping everyone safe. And then also us just teaching him how to protect himself and protect others. I feel like at this point, with the timeline that the schools are, giving for reopening phases and things like that, I'm okay with him going back to, in class learning.
And do you feel like from the social interaction, he's missing out a lot?
Oh, for sure. Definitely. I mean, it's very different having that kind of one-on-one, human interaction on video as opposed to being in the classroom or being with his peers and his teachers. So yeah, it's definitely different.
That's interesting. Now I hear this from a lot of different people, and honestly, like before this this event, I didn't actually ask them what they were going to say. So I didn't know where Muriel was standing with this issue, and then I knew John and I, we talked a little bit more on these because we have our other meetings. So I kind of knew what his position was. But so this is a real issue in a way that is affecting everyone at different level, because it's not just the pediatric population. But I do want to thank you guys, John and Muriel. I know you, no, Dr. Likido, you are staying. So
sorry, no, Kim, before we let them go, I just wanted to point out this. It came from them. So you have to feel comfortable about what the facility and what the schools are doing. So they both pointed it out. They have to feel comfortable about what the facilities are doing. You have to, John's kid is a little younger, 2.5. So it's a little bit more training about, how comfortable you are about, is it a girl or boy, John?
He's a boy.
Okay, so about how he's going to, use the mask, right? So that's you have to make them comfortable at home, like using it, so that when they're outside, it's like second nature to them. And they do adapt. So they're very good in learning.
Yeah.
So that's one thing.
Correct.
So whatever the house situation is, the parents have to feel comfortable about it. What's going to affect that? If there's somebody who's more at risk at home, then that might change the whole decision-making process. But Muriel also pointed out a big thing about this is, services that are being needed that can be provided through online learning. Those kids who have individualized education plans, those kids who have 504 plans, kids who are needing physical therapy, occupational therapy in school, speech therapy, and those who are needing counseling, mental health counseling. These are big subset of the population that have missed out on a lot of things during the initial lockdown.
All right. So, well, thank you, Dr. Liquido. So, John and Muriel, if you want to sign out, you're okay. Thank you for joining us.
Thank you for having us.
Thank you.
Thank you.
Dr. Liquido, I do want to talk about just for a couple minutes, like how we are actually supporting public so that from the integrated digital health point, like what's been done so far with telemedicine, telehealth, we actually kind of spiced up our YouTube channel and Facebook, and then we are putting these events in a good playlist for our patients to find them easily with different topics that we discuss, and then we try to keep them under 30 minutes so that it's easy to watch, and then also like specific topic. We have done so many of these, and we are getting really good feedback from our patients. And I just want to make sure that they also know that this is available from United Medical channels, from CRIAS, from my personal one. Those videos are all available out there. It's going to be recorded and will be available offline. Do you use these videos in while you are treating with your patient? Do you actually refer them to these channels, your patients, as extra support?
I have not yet. I will try to integrate that.
Sure, and because with like yesterday, I had no, actually the day before yesterday, Wednesday, we had one event with our bariatric surgeons, Dr. Mike Peters, and we discussed the complications of bariatric. This was the volume 6 of the events. So then we start from the beginning to the end. So all the different aspects of bariatric surgery we discuss, and we do the same thing with our diabetes sessions that we have. These are kind of like a webinar type, where we have another one coming up on the 14th. We call them our wellness webinars. And actually, as we started having this type of a platform, we wanted to add different voices into this so that we reach out to our local senator, Brian Townsend. And actually, he's confirmed that he'll be with us next week, next Wednesday, next Friday at noon. Now, the reason we are doing these events, obviously, we just want to make sure that there is enough help available for our patients. Now, with the pediatric goes from the clinical side from newborn to 21 years old, right? So they're still under pediatric. So that's a big range of age group. So some of those patients who are on the, like if they're teenagers, they can actually follow us on these, they can actually get through these events directly, and then they can find information. But for those little ones, we want to make sure that this is available for them. Now, do you want to add anything to handling the pediatric side of this? Like, do you have any like last minute comments before we close?
Well, the only thing, of course, is the home situation. It's very important for the kids to have routines. We emphasize that with the parents when they come in here. So even though they're doing virtual, we ask them to have a routine, have like a set places for place for kids to study. At their own corner, minimal distraction. We also it's very nice actually. They're doing physical education through Zoom. But there are some kids who would want, there was one mom who told me, oh, during that physical education, we just let him go out. And we tell the teacher, he's outside playing because he wants to be outdoors. And that's a very good thing. So, just keeping them active, of course. But one very important thing that I want to mention is monitoring for mental health, especially for older kids who are missing sports or missing socialization. It's one very important thing to look for signs and symptoms of depression and anxiety, and they need to open up how they're feeling. So
well, Dr. Liquido, this was very helpful. I'm hoping that everyone is finding these beneficial for them as well. But before we close, actually, I was just checking the score for your French Open.
He won.
He did. So Nadal won. So
Finals.
yes, he's on the final. So apparently the last one was on a tie break with 7-6. So I know that makes you happy. So well, thank you for again taking time, especially during your patient hours. And I do kind of torture our doctors with these types of requests, but I know you are always willing to help us.
Okay.
Yeah, thank you again. All right. Thanks. We'll see you soon. We'll be back next week, same time at noon with Senator Brian Townsend, and see you guys soon.